Okay, so what is Medicare? It's the federal program that's providing your hospital and medical coverage to you. It's available at 65, or if you have been awarded disability under 65. And there's a 2-year wait period if you're under 65 to be awarded disability, unless you have end-stage renal disease or ALS, which is Lou Gehrig's disease. It's run by CMS, which is the Center for Medicare and Medicaid. Benefits are controlled by Congress, which means it would take an active Congress to make changes. Nothing is going to happen overnight. There's, you know, right now, I mean, it is in the top of the debates and it's top of mind for everybody. No matter what they're suggesting, it's not going to change overnight. Social Security handles eligibility and enrollment, so they are the ones that you will talk to when it's time to enroll for Medicare. There are 4 parts to Medicare. Part A is the hospital coverage. This is, again, funded by the general fund and your working history of at least 40 quarters or 10 years. If you did have to pay the full Part A premium, it's $413. Again, it's your working history or your spouse's working history. So if you were a homemaker your whole life and didn't work, you still can qualify premium free for Part A. It's covering your inpatient hospital stay, an actual inpatient stay. Basically, it's the room and board, nursing staff, skilled facility, limited home health care, and hospice care. There is a per stay deductible of $1,316 per stay. If you are admitted to the hospital for a heart attack and you're in the hospital for a few days, this $1,316 is your first responsibility. If you go back into the hospital for the same condition or within 60 days, it's waived. If it is for a different condition or outside of the 60 days, you will be responsible for the $1,316 again. Skilled care is provided or approved after 3 full days. It's called the 3 midnight rule. You have to be an inpatient for 3 midnights before skilled care will be approved by Medicare. At that point, it's covered 100% for the first 20 days, and then you are responsible for a co-payment of $164.50 for days 21 to 100. Now, you might be starting to freak out about your out-of-pocket exposure, but we're going to get to more information on how you can limit this and mitigate these costs. Part B is financed through the general fund and your monthly contributions. If you're receiving Social Security, the premium will come automatically out of your Social Security check. If you are on Medicare but not receiving Social Security, you will be billed on a quarterly basis for Part B. Now, the premium this year starts at $134 per month. If you are a higher income earner, if it's $85,000 as an individual or $170,000 as a couple filing joint tax returns, you will pay a higher Part B premium. Yes?
Is Part B optional, or that's just an automatic thing?
It may be optional. We'll get to that in just a minute. Yep. But now with the income, the possible income, there are 4 levels of income that determine the prices that you would pay for your Part B, but the standard is $134. Now, if you've got a family member that's been on Medicare for a couple of years, their premium is going to be different than this. Those that came onto Medicare last year and new enrollees this year are paying $134. People who were prior to 2016 are paying $109. So if you see that difference with a family member, that's why, because they've been enrolled longer. You have an annual deductible of $183. This is often split up over multiple doctor's appointments. Medicare is generally paying 80% of approved charges, and you are left with the final 20%. This 20% is your largest area of exposure with Medicare. because it's unlimited. There is no out-of-pocket maximum with this 20%. Now, Part B is covering medical services, doctor's offices, lab work, durable medical equipment, x-rays, outpatient surgeries and facilities, the ambulance charges. All of that is filed under Part B, and you are responsible for 20% of all of those charges. Now, 20% of an office visit, not much. I mean, $50 maybe, but 20% of a knee replacement could be thousands of dollars. And that's one event in that year. So that's the thing that we need to protect the most. That's what we need to cover. One thing I just recently learned, and I'm very happy to be able to pass this on to you. Medicare does not cover routine dental and vision care. Your twice yearly cleanings, your x-rays, and vision refractions, checking your prescription. Medicare doesn't pay for that. What they will pay for is an eye exam to check the health of your eye. If you have high blood pressure, if you're diabetic, if you take high-risk medications such as insulin or methotrexate, if you have blurry vision, dry eyes, red eyes, there's a whole slew of conditions that can be approved for vision exams. I found a doctor in our area she's the one who brought this to my attention. And so what I did was I found someone here who is a Medicare accepting doctor. They have to be Medicare accepting for you to have this done. In Focus Eye Care, I cannot tell you if they are good, but excuse me, they do accept Medicare. So you'd be able to see them and receive these services at little to no cost to you. They should be able to do a refraction for you, but there's going to be a cost for that. So that's their information. And again, routine care is not covered by them. If you were in an accident and broke your jaw, say you had a slip and fall, or if you developed oral cancer, those are things Medicare is going to pay for. But it's the routine care they're not going to cover. Yearly physicals. With our group insurance, we can have a physical. With Medicare, you cannot. You can have a wellness exam. What's the difference between a wellness and a physical? Well, a physical is much more in-depth, head-to-toe screening, full comprehensive metabolic panel, very in-depth review. A wellness exam is check your height, weight, check your blood pressure, how are you doing, give you a depression screening, and here's a list of exams that you can have on this timetable. I had a nurse that was at a presentation one time and said, well, if that's all they're going to give me, of course I'm going to be depressed. They can run blood work, but it has to be diagnostic. So if you're taking a blood pressure medicine, the doctor has to order a diagnostic test to make sure that your blood pressure medicine is still working. If you're diabetic, they're checking your A1C and your blood glucose. If you're having symptoms that you might be hyperthyroidism, they are specific diagnostic tests. And they cannot be done in the same appointment as your wellness exam. It has to be done on a separate day, which is counterintuitive because now you have to come back for another appointment. And Medicare is paying for a second visit. But these are the rules. If it's done in the same day as your wellness exam, or they run a full panel, you are responsible in full for those charges. Now, we have seen bills between $170 and $174 for full blood panels. On one side of it, it's, why check for something if nothing is wrong? You're running blood work unnecessarily. But on the other hand, if you don't know something is wrong, if you're not testing for it, how do you know? And we have a perfect example. We have a longtime client who recently passed away, but his doctor ordered a blood panel accidentally. They found out he had stage 4 liver cancer. He was able to start treatment and prolonged his life a couple of months. But they would not have found it had they not accidentally run that blood work. Okay, Medicare Advantage, which is Part C. These are private insurance plans that are contracting on an annual basis with Medicare to provide your benefits for you. You've got HMOs, health maintenance organizations. They're the most restrictive kind of care, in-network coverage only. PPOs, preferred provider, in and out of network. And in Medicare, we've got ones called private fee-for-service, or PFFS. Oftentimes, these plans include drug coverage as well. So these would be called Medicare Advantage prescription drug plans. We're going to go into more detail on these in just a few minutes. Part D. Just remember D for drugs. These plans are covering your outpatient prescriptions, the prescriptions that you are taking on a daily basis yourself. You could have a standalone prescription drug plan or one that's part of a Medicare Advantage plan. Now these are voluntary. Voluntary. You do not have to have a drug plan. But if you don't have a drug plan and you don't have other credible coverage, such as group insurance, retiree coverage, the VA. If you qualify for the VA, you have to be enrolled with them. You don't have to use it, but you have to be enrolled, and then you could avoid the penalty. Now the penalty is 1% of the average national premium for the year, which is 34 cents a month, not life altering. For a year, if you were without a plan, that penalty would be about $5. But you keep the penalty for life. So you enroll in a drug plan next year and the premium might be $15. Well, because you have that $5 penalty, you're going to pay $20 a month for that plan. But the following year, you change your plan and it's $30 a month. Because you have that $5 penalty, you're going to pay $35 a month for that plan. It stays with you for life. We've got clients that have never had a drug plan because they either don't have any drugs or they have very low cost drugs. They're just risking it. They're just assuming more risk in that situation. We've also got clients that have a drug plan even though they take no medication, just in case. They don't want to take the penalty, and if they're put on something, they might have coverage. The reason I say they might have coverage is because every plan is different. I believe in your area there are 23 plans available. Every one of them is different, and they all have different formularies. So no plan is covering every drug. Now if Medicare could make any part, or the government could make any part of Medicare confusing, it's the drug plans. They all have the same structure, whether they're standalone or within a Medicare Advantage plan. You've got a premium for your plan, and you've got tiered co-payments. Now the plans can choose to have a deductible or not. If your plan has a deductible, you're going to pay full cost until you have met that deductible. This year the maximum is $400. At that point you go into the initial coverage. Here you're going to pay a co-payment for your prescription. In our example, your co-payment is $10. But it's the full cost of the drug that determines when you move, if and when you move into the next phase. When your full cost reaches $3,700, you move into the donut hole or coverage gap. So your $10 copayment is for a $100 drug. It's the full $100 that is applying to that $3,700 threshold. You can think of it like a bank account. You've got $3,700 in there. Each time you fill a prescription, it is chipping away at that amount. When it zeroes out, you're moving on to the next phase. Or you could think of it like you're making deposits. You're going to deposit $100 every time. And when your account reaches $3,700, congratulations, you're moving on up. You're going to move into the donut hole or coverage gap. Now here, you're still going to pay a copayment, but you have a higher cost sharing. You're going to pay 40% of brand names and 51% of generics. So with our $100 drug, we're going to say it's a brand name. So you're paying $40, you're going to pay a $40 copayment for that medication. $10 for it to $40. Now the manufacturer is giving a discount for that of 50%. And then there's another discount of 5% in there that is helping get you out of the donut hole. When your cost goes from $3,700 to $4,950, that is when you move into the final phase of the drug plan, which is catastrophic coverage. Here you will pay no more than 5% of the full cost for the rest of the year. Getting into the donut hole, it is 100% of the cost. To get out of the donut hole, it's 95% of the cost. It's kind of an unfair trade. 100 gets you in and 95 gets you out.